सबै नेपाली दर्शकवृन्दहरुमा मेरो नमस्ते। नेपालमा चाहिँ आत्महत्या कोरोनाले गर्दा सुसाइड र डिप्रेसनको रेटहरु बढ्दै गएको हुनाले चाहिँ आज मानसिक स्वास्थ्यको जनचेतना बढाउन यो कार्यक्रम आयोजना गरिएको हो र यहाँ दुईजना आगन्तुकहरु हुनुहुन्छ। So Dr. Phil is with us, and then Sarada is with us. I would like Dr. Phil to briefly introduce himself before we start this session.
Yes, I'm Dr. Phil Gosselin. I'm a clinical psychologist in Amherst, Massachusetts, and I used to be the head of behavioral medicine at Franklin Medical Center in Greenfield. I've also taught at Keene State and Union Institute and a bit in UMass. And suicide isn't my first area of expertise, but when you're a practitioner in a rural area, you have to be familiar with experience, and I can hopefully add something to the thoughts that you've put down here already. So thank you.
Thank you. धन्यवाद Dr. Phil. So we have also Sarada. Sarada बहिनी हामीसँग छिन्। उ चाहिँ नेपालकै हुन त अमेरिकामा नर्स प्र्याक्टिस गर्दै छिन्। Sarada आफ्नो परिचय पाऊँ।
Hi, namaskar everyone. मेरो नाम शारदा पौडेल हो है। म चाहिँ recently UMass Amherst बाट चाहिँ मेरो डक्टर अफ नर्स प्र्याक्टिसनर कम्प्लिट गरेर अहिले म चाहिँ बे स्टेट साउथ ह्याडलीमा चाहिँ प्राइमरी केयर प्रोवाइडरको काम गरिरहेको छु है। So since I had some background of the psych, I used to work in McLean Hospital in Boston. So I saw a lot of people with history of suicide, even in the older people who has dementia, Alzheimer's, and women with postpartum depression, and people who has history of drug abuse. So I want to share with my experience with you guys today.
अनि आजको हाम्रो फोकस चाहिँ दर्शकवृन्दहरु मुख्यतः चाहिँ मानसिक स्वास्थ्यको बारेमा जनचेतना फैलाउने, डिप्रेसन बुझ्ने, डिप्रेसन तनाव र आत्महत्यालाई कसरी रोक्ने। सो तपाईहरुले देखिहाल्नुभयो स्लाइड्समा कि हाउ टु क्रिएट अवेयरनेस अन मेन्टल हेल्थ, and then that way we can know something about depression, so families can help. That's the idea. So the main driving factor for today's this Zoom meeting was तपाईहरुले यहाँ देख्न सक्नुहुन्छ कि since the lockdown started, as you can see, the number of deaths due to suicide is the highest in Nepal. It's about anything else. त्यसैले गर्दाखेरि चाहिँ यो आत्महत्याको रेट एकदमै बढिरहेको छ। त्यसैले गर्दाखेरि चाहिँ यसको अलिकति मानसिक स्वास्थ्यको चेतना फैलाउन भनेर नै यो हामीले सुरु गरेका हौं। पहिलो कुरा त तपाईहरुलाई थाहै छ डिप्रेसन र तनाव नै मुख्य कारण हुन्छन् आत्महत्याका। So Dr. Phil, as you can see here, this is a pictorial diagram here, right? The stress. So in general, stress and depression and suicide are kind of related, So would you like to elaborate on these kind of things? What causes stress, particularly to youth?
Well, suicide is often correlated with depression, and depression has two aspects, what they call endogenous or exogenous. Endogenous means that even on a good day, your internal body chemistry or your past may give you this feeling that life is worthless and that there's no hope. Exogenous means if enough bad things happen to us, if the financial stressors or health stressors or family stressors are so large, we may think that life is overwhelming and it's not possible to really continue. So clearly this COVID crisis and the financial crisis that attends it constitutes a tremendous exogenous crisis for all of us. And each of us has a sort of a breaking point, and in which we suddenly become very vulnerable to depression, and in more extreme cases to suicidal thoughts and ideation and possibly attempts. So we should be trying to help each other as well as we can and to get through this difficult thing. Know that we're all in a similar situation, although some have it a lot easier than others. There's no doubt about that.
Yeah. Thank you, Dr. Phil, for that clarification. We'll be coming about depression more on coming slides. Sarada bhai ni केही भन्नुहुन्छ तपाई स्ट्रेस को बारेमा अलिकति नेपालीमा
स्ट्रेस को बारेमा इन केस नेपालको कुरा गर्दाखेरि because of the social stigma, people don't like to talk about depression. For them, you know, they are more comfortable talking about like diabetes, high blood pressure, any kind of physical symptoms. But depression चाहिँ हाम्रो समाजमा नै सोसाइटीमा नै डिप्रेसन भन्दा बित्तिकै नराम्रो तरिकाले हेर्ने एउटा कल्चर छ
बहुलाय छ भन्ने कलंकित गरिएको छ यसलाई हैन
र अकॉर्डिङ टु माय एक्सपीरियन्स म नेपालमा हुँदासम्म मान्छेहरू डिप्रेसन सिभियर भएर रोडमा नआएसम्म चाहिँ उनीहरुको ट्रिटमेन्ट नगर्ने कन्डिसन देखेको छु मैले हैन र here I work in a primary care you know, as a general medicine. Even when you go to the doctor's office or as a general provider, it is really important for them to ask the depression screening question. You know, only physical thing matra important haina ki psychological issue pani really important cha. So here we have just like a depression screening questions whenever the patient came our office. So those kind of questions, it's called the PHQ 90 score, or we have another PHQ. So this PHQ score gives us some idea how the people, you know, give the some kind of severity of the symptoms. So it's just like high blood pressure and diabetes and other kind of condition. It is equally important to ask screen depression for every single patient.
धन्यवाद सारा पनि त्यो परिचयको लागि हामीले चाहिँ शारीरिक रोग जस्तै मानसिक रोगलाई पनि सामान्य रूपमा लिनु पर्यो यसलाई कलंकित गर्नु भएन र यसका निदानका उपायहरू गर्न सकिन्छ र अस्पतालमा चाहिँ विभिन्न प्रश्नहरू पनि छन् र सहयोगहरू पनि प्राप्त छन् हामीले यसको बारेमा अलिकति खुल्नु पर्यो अब अर्को कुरा आउँदाखेरि to be little more specific on few symptoms Dr. Phil so that the family members may be able to recognize the early symptoms, you know, would you like to elaborate on what are like the visible things, you know? I mean, of course we can read these things online also probably, but how would you like know that somebody is kind of going to depression, you know, initially?
Well, I think this list is quite good, and I think so family members or people that are close might notice these. Friends might also notice. Practitioner, let's say someone came into a primary care office, they may or may not notice because it's such a fast interaction. So Sharada's thing about checking in is very good. Clearly in psychotherapy, you would tend to be on the lookout for all of these kinds of things. So hopefully it's much more apparent in those situations.
Mm-hmm. Thank you, Dr. Phil. शारदा बहिनी केही लक्षणहरू चाहिँ प्रारम्भिक रूपमा परिवारले साथीहरूले चाहिँ के कुरामा विशेष ध्यान दिनु पर्ला मैले केही कुराहरू चाहिँ लेखेको छु
So for the लक्षणहरू just like as I was talking, it's we have here in America we use called the PHQ screening question. So those are those question त्यो questionले नै एउटा these are like a sign and symptoms. For example, you know, some people have just like कोही मान्छेलाई चाहिँ केही गर्ने जुन कुरामा उनीहरुलाई real कुरामा interest हुन्थ्यो नि. For example, they like to go for a movie, they like to play, they like to, you know, involve in some kind of interesting games. So त्यस्तो सधैँ इन्जोय गरिराख्ने कुरामा उनीहरुले इन्जोय गर्न छोड्छ है एउटा चाहिँ. अब कसैको चाहिँ स्लीप डिस्टर्बेन्स हुन्छ हैन. अब कोही चाहिँ एकदम धेरै सुत्ने अब डिप्रेस भयो भने कसैको चाहिँ निन्द्रै नपर्ने हुन्छ हैन. अब कसैको चाहिँ feeling of worthless भनेर भन्छ के. Oh, I'm worthless अथवा
चिन्ता बोध गर्ने एकदमै लो फिल गर्ने हैन.
अनि मैले चाहिँ मेरो फ्यामिलीलाई डाउन गरे हैन, फ्यामिलीको एक्सपेक्टेसन पूरा गर्न सकिन भन्ने हुन्छ हैन. अनि अब कसैको चाहिँ ओभर इटिङ हुन्छ, खाएको खाइ हुन्छ अथवा एपेटाइट सप्रेस हुन्छ कसैको हैन. अब some people have thoughts of harming self and others हैन. So even for the depression, it's their personally, they don't want to harm themselves. It's their psychological thing. It's called some people severe depression. Some people might get hallucination. You know, they start hearing voices. You know, once it gets severe, you know, they have the false belief. You know, so but these are the more severe. But you know, mild symptoms. You know, agadi मैले भने नि अब severe weight gain हुन सक्छ, they are not interested on the things that they used to be interested, हैन? So यस्तै हो इनिशियली चाहिँ।
धन्यवाद शारदा बहिनी। सानसानो कुरामा झर्किने हैन, एक्लै बस्न चाहने, एकदमै नकारात्मक र हीनता बोध हुने, अनि त्यसपछि अलिकति अप्रासंगिक कुरा गर्ने हैन, यस्ता लक्षणहरू चाहिँ हाम्रो परिवार साथीहरुमा देख्यो भने हामीले अलिकति त्यो कुरालाई विचार गर्नु पर्यो हैन। अरु त शारदा बहिनीले भने यस्ता गम्भीर लक्षणहरू पनि देखिन्छन्। अब अलिकति बढी कुर्दाखेरि चाहिँ सबभन्दा त्यही त सबभन्दा ठूलो कुरा चाहिँ अवेयरनेसकै छ के नेपालमा चाहिँ हाम्रो सोसाइटीमा। So Dr. Phil, the problem, one of the biggest problem is it doesn't get really noticed until it gets to a severe point, you know, when they start doing some really weird stuff, or at least attempting suicide or something, you know, people don't pay attention until it gets to that chronic stage of depression, you know. So it's never enough to say, like, you know, how much awareness we need, particularly in developing countries, right, about this. Dr. Phil, would you like to suggest few things, practical things, you know, that can be done at like a family level or society level that can create awareness, you know, from our individual level also?
It's a very important, important issue. I think that sometimes we set up this structure in our mind that we can't ask for help, but really we've been helped all our lives. We were helped by our family growing up. We're helped by the schools. And the idea that somehow when we become an adult that should end and we should just totally be on our own and everything should be determined by ourselves and can get in our way. So it's useful to have a coach or helpful ear at least at certain times in our life, and to be looking for advice or support. And I think that sometimes Western psychotherapy looked a little bit intimidating and a little bit stigmatizing, as you have here on this. And so the idea that we want to now try and have people see this as mostly coaching, and that we all come to different points in our life where things become quite difficult for us. And we need to talk about it. We need to maybe have a friendly ear, and we also maybe need some advice. So I think that's we're all in this situation, and particularly when the world is in crisis, it becomes even more so.
Thank you, Dr. Phil. त्यही त धन्यवाद। हामी सबै कुराको लागि सहयोग लिइरहेकै हौं। हामीले मानसिक स्वास्थ्यको लागि सहयोग लिन पनि अप्ठ्यारो मान्नुहुन्न। हामीलाई खान पनि कसैले सिकाएको हो, बोल्न पनि कसैले सिकाएको हो, त केही समस्या पर्दा हामीले साथीभाइमा भन्नु पर्यो र यदि प्रोफेसनल हेल्प चाहिन्छ भने लिनु पर्यो। शारदा बहिनी, यसमा तपाईको के भन्नु छ नेपालको कन्टेक्स्टमा? अब
मेरो भन्नुपर्दा कुरा फर्स्ट एजुकेसन कहाँबाट जान्छ भने जस्ट जुन जनरल प्रोभाइडरले एउटा डिप्रेसन डायग्नोज गर्नुभयो पेशेन्टलाई, त्यो पछि sometimes general provider can treat them for, you know, they can tell their patient that this, you know, when they prescribe medication or when they refer to the psychologist, they really need to spend their time with the patient, just like this is also the medical condition. This also, you know, can kill you equally like other medical disease. So that's why they have to, you know, educate patient very well. And also another thing is, you know, family member हाम्रो समाजमा कस्तो छ भने कसैले डिप्रेसनको मेडिकेसन खान्छ अथवा डिप्रेसन छ भने चाहिँ डिफरेन्ट रूपमा हेर्ने छ, त्यो चाहिँ फर्स्ट
त्यसलाई कलंकित गरिन्छ। त्यही त बोलाछ भनिन्छ हैन,
रिलेटिभ्स हैन। अनि त्यो पछि नेपालको कन्टेक्स्टमा मैले कस्तो देखेछु भने स्पेशली फर द वुमन, they don't want to go to the psych hospital. They don't want to be hospitalized because, you know, sometimes it's not safe. Sometimes there is not enough, you know, psychiatrists. So, मेरो विचारमा एउटा different model start गर्यो भने चाहिँ I think that would be really helpful. For example, if some patient has a history of depression, we can create some kind of mobile team, and then they can go their house, screen those, and provide psychotherapy, and then, you know, treat and monitor the patient. But I haven't heard this kind of system yet, but in future, if you're able to,
एकदमै सही कुरा
initiate
गर्नुभयो शारदा बहिनीले।
that
हाम्रो
would be really
नेपालमा चाहिँ यस्तो ग्रुपहरू बनाएर हामीले अलिकति जनचेतना फैलाउने, अलिकति त्यस्तो हिस्ट्री, त्यस्तो इतिहास रहेकाहरूको हैन मा घरमा जाने, अलिकति
so
चेतना फैलाउने।
that way they will get your privacy as well. समाजमा मान्छेले नराम्रो सोच्छ भनेर उनीहरू हस्पिटल पनि गइरहेको हुँदैन, साइक हस्पिटल हैन, साइक फलो पनि गर्दैन र मेडिकेसन नै खाँदैन। But if it is more private, I think they will continue to follow the instruction and seek help.
धन्यवाद बहिनी। त्यही त त्यस्तो अलिकति यसको गोपनीयता पनि मेन्टेन गरेर चाहिँ घर घरमै जहाँ समस्या छ त्यही पुर्याउन सकियो भने चाहिँ मान्छे अलि बढी खुल्थे कि हैन। त्यो सुझावको लागि धन्यवाद बहिनी, हामीले त्यो पहल गर्नै पर्छ। So Dr. Bill, these are very general, like what can we do, to live a balanced life. Of course, this may sound cliche, but do you have anything to say, in general, like general good practices to keep a good mental health,
So on the be active, they're discovering more and more that lots of exercise is as powerful as antidepressant medication. So it may not take its place, but it's a powerful thing, and everyone should keep that in mind. Connection, very much. They notice that sometimes elders, particularly males, tend to not have as many connections, at least in Western society, and that it seems to be connected with greater rates of depression. And as we know, sort of keeping yourself stimulated, involved in life, that's very good. These things are all helpful against stress and against depression.
अब शारदा बहिनी, नेपालको कन्टेक्स्टमा चाहिँ यो कुराहरू कसरी लागू होला त? कनेक्ट त हामीहरू अब फेसबुकमा कनेक्ट त छौँ, तर अब अलिकति मैले चाहिँ अलिकति देखावटीपना पनि बढी देख्छु कि नेपालकोमा हैन। हामी समस्या शेयर गर्न मान्छेहरू कमै हुन्छन्, देखाउने बढी हुन्छन्। यस्तो कन्टेक्स्टमा चाहिँ अब भनौँ केही समस्या छ भने के गर्दा हेल्प होला त समाजमा?
समाजमा अब मान्छेको प्रब्लमहरू त सबैको हुन्छ, नहुने हुँदैन हैन। अब नेपालको कन्टेक्स्टमा फर इक्जाम्पल समटाइम हामीले टिनेजको मान्छेहरूलाई देखिरहेको हुन्छ हैन। उनीहरूको बुवा आमाहरूले चाहिँ प्रेसर गरेर फर इक्जाम्पल त साइन्स पढ्नुपर्छ, त डक्टर पढ्नुपर्छ, त्यो हुन्छ। कसैलाई त्यस्तो खालको प्रेसर हुन्छ र उनीहरूले चाहिँ त्यो कम्प्लिट गर्न सक्दैन र डिप्रेसनमा जान्छ र सुसाइड गर्छ हैन। अब त्यसको लागि चाहिँ मोर फ्यामिली सपोर्ट हुनु चाहिँ एकदम जरुरी छ है। र फ्यामिली सपोर्ट दे क्यान सेयर विथ देयर फ्रेन्ड्स, दे क्यान सेयर विथ हुन्छ नि कसैको मेन्टर छ र त्यो भयो भने पनि हुन्छ। र सेल्फ आइसोलेसन इज द मेन हुन्छ नि डिप्रेसनको वान अफ द मेन रिजन हो। अब सेल्फ आइसोलेसन फ्यामिलीले पनि मोनिटर गर्नु पर्यो। यदि सेल्फ आइसोलेसन छ भने दे क्यान एडभाइज देम टु सिक केयर हैन। अब कनेक्टेड त अब यहाँ जस्तो सेल्फ आइसोलेसन त त्यति देख्दिनँ मैले नेपालमा हैन। मेरो पनि लास्ट इयर एउटा हुन्छ नि एकदम राम्रो साथीले रिसेन्टली सुसाइड गर्यो हैन। ही लुक लाइक रियली चियरफुल आउटसाइड, एभ्रिथिङ फाइन, बट you never know what's going on inside,
त्यो तिमीले सही भन्यौ नानी। भित्रको मनको कुरा खोलेर सबैसँग भन्ने कुरा पनि भएन हैन। साथीहरूले अलिकति यस्तो कुरामा विचार पुर्याइदिनु पर्यो, अवेरनेस क्रिएट गर्नेमा। दाइ भाइ दिदी बहिनी अथवा जसलाई हामीले विश्वास गर्न सकिन्छ उनीहरुसँग
we have sense of the failure even in the family. Family is the first फ्यामिलीले नै पहिलो प्रोभाइड केयर गर्नुपर्छ। उनीहरुलाई एटलिस्ट बेसलाइन थाहा हुन्छ अरूलाई भन्दा हैन।
हुन्छ, धन्यवाद नानी। अब अर्को कुरा चाहिँ अघि मैले भनिहालेँ, so this COVID generated isolation, right, and then lockdown and then financial crisis, this is leading to a crisis, then they have even defined this term called COVID-19 related social isolation and depression, Dr. Phil, of course it's really depressing. We have been living in isolation for almost 2-3 months now here. So do you have anything to say on this, Dr. Phil? What would help, in this kind of crisis scenario?
I like this slide. It has a lot of good points in it. I think almost all the points are right on the mark. So I think depending on the culture and the situation there, I think to use as many of these as possible. For depression as well as for anxiety, there are all kinds of suggestions, and you don't have to do all of them, but you have to find out which ones seem to make sense for you, and which are attractive and which you can follow through on. So I like all of these.
थ्याङ्क यू डाक्टर फिल। तपाईँले यहाँ देख्नुभयो जस्तै स्लाइड्समा कि हामीले नकारात्मकतामा भन्दा पनि अलिकति सकारात्मक कुराहरूमा चाहिँ ध्यान दिनु पर्यो यस्तो बेलामा, धेरै नकारात्मक समाचारहरू हेर्नुभन्दा पनि। अनि अब सहयोग आवश्यक हेल्प चाहियो भने माग्नु पर्यो होइन? शारदा बहिनी यसमा केही भन्नु छ?
सो यसमा अहिलेको मेरो एक्सपिरियन्स अनुसार चाहिँ इभन इन युनाइटेड स्टेट आई थिङ्क दिस वुड बी सेम अन बोथ केस इन नेपाल एन्ड युनाइटेड स्टेट आर नो म्याटर वेयर होइन. सो फर इक्जाम्पल वान चाहिँ डिजिज रिलेटेड हुन्छ नि, डिजिज रिलेटेड एन्जाइटी भएर उनीहरूको डिप्रेसन बढिरहेको छ होइन. अनि अर्को केस चाहिँ ड्यु टु जब लस एन्ड फाइनेन्सियल सपोर्ट होइन. For example, even here, even Nepal, so I had some patient, they have kids, they have to find, they lost their housing, they have to find a new apartment, they lost a job, so they have to afford their kids. And at this point, nobody like to, nobody like to empty their house, so it is really hard to find the new housing as well. सो आई थिङ्क नेपालमा पनि कोही मान्छेहरूले चाहिँ भाडामा दिइरहेको छैन भन्दा सुनिरहेको थिएँ मैले होइन. र भाडामा भएको मान्छेहरूले पनि बसिरहेको मान्छेलाई चाहिँ इफ कोभिड रिलेटेड सिम्टम्स भयो भने निकाल भन्ने तनाव दिइराखेको छ होइन. अब सबैलाई त्यस्तो त्यस्तो प्लस अनि जब लस भइरहेछ भने फाइनेन्सियली पनि सपोर्ट गर्न गाह्रो भएर मान्छेहरू डिप्रेसनमा गएको सुनिरहेको छु मैले होइन. यो चाहिँ नट ओन्ली युनाइटेड स्टेट, नट ओन्ली नेपाल, इट्स ग्लोबली दिस थिङ ह्यापनिङ राइट नाउ.
त्यही त सबैले अलिकति संवेदनशील भइदिनु पर्यो, अर्काको समस्या बुझिदिनु पर्यो होइन यस्तो समस्या.
Yeah, and also I saw the recent report and it's not only news, it's only going on our practice and our everywhere. The antidepressant medication I saw in the report is called it's called the SSRI. In this time, अहिलेको यो टाइममा चाहिँ प्रिस्क्रिप्सन अफ एन्टिडिप्रेसेन्ट चाहिँ रियली हाई भइरहेको छ भनेर चाहिँ त्यो एउटा क्लासको मेडिकेसन चाहिँ अहिले सर्टेजमा राखिरहेको छ क्या अहिले लेटली होइन. सो इट्स नट हियर, इट्स एभ्रिवेयर. सो
अलिकति हामीले ध्यान दिनु पर्यो, यो समस्या सबैतिर छ. अब अर्को चाहिँ सामान्यतया अघि पनि हामीले बोल्यौँ, we have been talking about breaking the stigma and then asking for treatment. So Dr. Phil, there are few options mentioned on the left side of the slide. So would you like to elaborate a little bit on how that might be more accessible, or how can we approach those things?
Well, I'm not sure how that's the availability is in Nepal, but generally speaking, you can imagine almost a pyramid there in which mental health counselors are the most available and social workers next. They have to have a social work degree. Clinical psychologists usually have to have a doctorate, and psychiatrists have to have an MD. And certainly in the US, psychiatrists are now mostly used for prescribing medication. Psychologists used to do testing, but they don't do so much of that now. Psychologists, social workers, mental health counselors all do psychotherapy mostly. And in terms of psychotherapy, there are hundreds of different types of psychotherapy.
Yeah.
In other words, there are things that have been developed by different people and they like to name it this or that. But really, in an ideal world, the treatment is tailored to the person who's coming in. What is it that they need? What is it that they can work with? What is it that's going to be useful for them? What resources they might be able to find? So insight therapy usually refers to an older type of therapy in which is very lengthy and financially challenging, and not so much. That's not so much anymore. Cognitive and behavioral therapy is very, I think, relatively user-friendly, and it's, I think, also quite synergistic with an Eastern way of looking at things. The idea of cognitive therapy is the idea that we're all thinking all the time, and that some of our thoughts are not helpful and repetitious and boring and painful, and which very much accords with a meditative view of life. And so the idea with cognitive therapy is you learn to recognize the painful thoughts, like if you're thinking I'm not good enough, or I'm doomed, or my situation is totally impossible and nothing can ever change. Those are thoughts which likely are not true and which we afflict ourselves. So the cognitive therapy would deal with that. Behavioral therapy would, let's say you were stuck on your couch so depressed that you just couldn't get up and work anymore. And the idea would be that let's get you back outside, let's get you working, let's get you this, let's get you that. And that if that's not possible, then you would need more of an intervention, perhaps an antidepressant that's listed as drug therapy there. And if that's not going to be enough, hospitalization as a sort of a last resort.
Thanks for elaborating all this, Dr. Phil. शारदा बहिनी, अब नेपालको कन्टेक्स्टमा चाहिँ यो कतिको तिमीले फिजिबल देख्छौ हैन यी विभिन्न
नेपालको कन्टेक्स्टमा चाहिँ अहिले हाम्रो लेखिरहेको कुराहरुमा चाहिँ एकदमै कम हुन्छ नि, कम देखिरहेको छ। जस्तो त्यहाँ चाहिँ एउटा कोअर्डिनेसन अफ केयर भन्ने चाहिँ छैन हैन, एन्ड अनदर चाहिँ कन्टिन्युटी अफ केयर भन्ने छैन त्यहाँ हैन। So the way how it system works in America is just like, for example, I'm a general provider here. First of all, patient come with me here. I diagnose, sometimes I treat myself. And if it is more, you know, I send to the, therapist. And also if they need to, diagnose more depression, bipolar, or any kind of other mental health condition, we send for the, psychiatrist here. Yeah. So in नेपालको कन्टेक्स्टमा चाहिँ अनि यहाँ चाहिँ हाम्रो त्यो कुराहरुमा जसको चाहिँ मेन्टल हेल्थ प्रब्लम छ त्यो चाहिँ सोशल वर्कर पनि इन्भल्भ भएर दे वर्क बिट्विन कोअर्डिनेसन अफ साइकियाट्रिक हैन, थेरापिस्ट र प्राइमरी केयर सबैको हेल्थ कोअर्डिनेसन गराउनको लागि हेल्प गर्छ हैन। र उनीहरुले त्यो गर्छ। त्यो हाम्रो नेपालको कन्टेक्स्टमा अहिले असम्म सुनेको चाहिँ छैन। अहिले रिसेन्टली भए त्यो
धन्यवाद बहिनी, एकदम सही भन्यौ तिमीले। प्राथमिक उपचार सेवा प्रदान गर्ने र चाहिँ यस्तो स्पेशलाइज केयर गर्नेको बीचमा चाहिँ समन्वय हुनु पर्यो नेपालमा। र सबभन्दा ठुलो त यो मानसिक बिमारीलाई चाहिँ कलंकित गर्ने, स्टिग्माटाइज गर्ने कुरा चाहिँ कम गर्नु पर्यो हैन। यसलाई पनि अरु रोग जस्तै अरु डाक्टरले पनि मानसिक रोगहरुतिर रिफर गरिदिनु पर्यो त्यस्ता सिम्पटमहरु मिल्यो।
या सो मेरो भनाइ हो अनि सो इफ यु आर डिप्रेस्ड दैट इज हुन्छ नि त्यो इम्पेयर गरिरहेछ रेगुलर लाइफमा, के पनि गर्न सके छैन हैन, लो भएर बसेछ, एनर्जी पनि लो एनर्जी छ हैन। सो अब हेडेक्सको चाहिँ एउटा औषधि खाएर सन्चो हुन्छ भने र यसको पनि के एउटा फर एक्जाम्पल इभन पिल नै खाएर एनर्जी लेभल हाई हुन्छ अथवा साइकियाट्रिस्ट काउन्सिलिङ गरेर आफ्नो मुड चेन्ज हुन्छ हैन। र त्यो गर्नुमा चाहिँ वाट्स द डिफरेन्स हैन, के पनि डिफरेन्स छैन त्यो गर्नुमा, नथिङ रङ हैन। सो त्यो चाहिँ सबैले बुझ्नको लागि जरुरत छ।
एकदम धन्यवाद बहिनी। अब यो स्टिग्माको बारेमा हामी अब अरु कुरा गर्यौं। अब अलिकति चाहिँ घरेलु उपायहरु अथवा भनौं होलिस्टिक मेथड्स। So Dr. Phil, we did talk about the other options, traditionally or conventionally available options, but there are some self-care options also, which we often talk about the holistic methods. And would you like to elaborate on few of these things, that might help?
Yes, Western psychotherapy in the last 120 years has gone through a number of changes about the relationship to these holistic methods. In the early days, psychotherapy and psychology seemed to be antithetical to a spiritual point of view, that the two seem to be somewhat separate, but they've certainly come back closer together. And so along with research studies that show the documentable effects from meditation, yoga, Tai Chi, and the other ones that you've listed here, that it's become much more, they like to think of it as a synergy with psychotherapy. So these things are often prescribed. Of course, it's easy to prescribe meditation. It's a little bit harder to do.
That's true.
So meditation, yoga, and Tai Chi, yeah, we always sort of say these things, but we're always pleasantly surprised when people really do them.
Yeah, that's true. सही भन्नुभयो। अनि शारदा बहिनी त्यही त, त्यस बाहेक पनि अब आफ्नो आत्ममूल्याङ्कन गर्ने हैन, विचारहरूलाई यसो भावनात्मक उतार चढावलाई अवलोकन गर्ने, ध्यान सजगताहरू बढाउनले यस्तोले यस्तो मद्दत त गर्छ नै हैन। तिम्रो केही भन्नु छ यसमा?
त्यही हो डाक्टर फिलले भने जस्तै हैन। अब योगा मेडिटेसनले चाहिँ हेल्प गर्छ, रिल्याक्सेसन टेक्निकहरू हैन। अब त्यो नै हो, त्यो चाहिँ अब त्यही हो भन्न सजिलो छ तर कन्टिन्यू गर्नको लागि गाह्रो छ अब सबैले गर्दैन त्यसको लागि आज गर्ने भोलि नगरेर नि हुँदैन हैन सो
विशेष
त्यो
गरी
पनि
चाहिँ
कन्टिन्युअसली भयो भने चाहिँ हुन्छ
निरन्तरता चाहियो विशेष गरी चाहिँ बिरामी अब स्ट्रेस भएका अथवा डिप्रेसन सिम्पटम देखिनेहरूले चाहिँ अलिबलि विचार पुर्याउनु पर्यो यसमा हैन परिवारले पनि त्यस्तो वातावरण मिलाउनु पर्यो so हामीले we talked a lot about stigma sometimes I have seen like somebody who is depressed, right? So obviously they lose the interest to do anything, and then sometimes the family members or friends take it as that guy is lazy, and then these kind of things, sometimes these kind of stigmas are there all around, floating around. And then if somebody is telling that I'm getting suicidal thoughts, then people just interpret it as he's seeking attention, Dr. Phil, how can we deal with this? How can a patient deal with this? How can he convince his immediate family or friends that there is a problem here and they need to recognize,
Well, usually it's not the situation where the person's trying to convince other people. It's that they're sort of trying to hide it a bit. But there are situations where there's talk about sometimes suicide attempts are sometimes seen as a cry for help. And in this case, women tend to have more suicide attempts than men, but men tend to fully carry out the suicide. In other words, they die from it at much higher rates. That's probably here because guns are available and men get into a macho feeling like I must be a man, I must take this violent action, whereas women don't tend to be thinking like that. So clearly there's some things that sometimes a suicide attempt is a cry for help, but it's we should be aware of that. We should be on the lookout because most times people are trying to hide any suicidality. They sort of say, you ask them, is there any problem? No, nothing, nothing. So, again, those with depression, those who are really sort of curled up and really can't get moving, the idea that they're lazy is, that's sort of like adding insult to injury. In other words, at a time when they're feeling most down, then being criticized. Trying to get them to move is useful, but encouragement tends to help a lot more than insults.
धन्यवाद डाक्टर फिल हामीले त्यस्तो चाहिँ मानसिक बिमारीको घाउमा चाहिँ नुन छर्किने काम गर्नुहुन्न उनीहरूलाई बुझिदिनु पर्यो उनीहरूको पुर्मर्का सुनिदिनु पर्यो हैन उनीहरूलाई पागल बौला जस्तो शब्दहरूले कलंकित गर्नु भएन यो समस्या कसैलाई पनि आउन सक्छ हाम्रै परिवारलाई आउन सक्छ हामीलाई नै पनि आउन सक्छ हैन शारदा पनि यसमा अब हामीले धेरै भन्न त भन्यौ हैन यस्ता कुराहरुमा अलि
अब यसमा भन्दाखेरि म एउटा स्पेसिफिक पोइन्ट जोइन गर्न चाहन्छु हैन एउटा नेपालमा रिसेन्टली अहिले मैले न्यूज सुनिरहेको थिए हैन एउटा कोही आइमाईले चाहिँ बच्चा मार्यो रे हैन कस्तो अब त्यसमा चाहिँ that वुमनलाई ब्लेम गरिरहेको छ कस्तो होला आफूले बच्चा पाएर पनि मार्यो यस्तो गर्यो उस्तो गर्यो भन्छ हैन सो नेपालमा यो पोस्टपार्टम डिप्रेसन भन्ने चाहिँ एकदम लिटिल एटेन्सन दिएको भेटिरहेको छु मैले हैन फर एक्जाम्पल नेपालमा स्टिल कसैले बर्थ घरमै दिइरहेको हुन्छ र कसैले हस्पिटलमा दिइरहेको हुन्छ हैन इभन घरमा दिएको त ल नेपालमा फलो अप गर्नु नै एकदम कम छ ओबीजीवाईएन सँग हैन त्यो चाहिँ पोस्टपार्टम डिप्रेसन युजुअली ओबीजीवाईएन ले फलो अप गर्दाखेरि चाहिँ डायग्नोज गर्छ युजुअली है अथवा जनरल डाक्टरले नेपालमा चाहिँ त्यो फलो अप बच्चा पाइसकेपछि डाक्टरसँग फलो अप एकदम कम छ हैन र त्यो गर्दाखेरि उनीहरु यस्तो डिप्रेस भइरा हुन्छ हार्मोनल चेन्ज भएर हैन त्यो तरिकाले चाहिँ उनीहरुले चाहिँ आफुलाई अथवा बच्चालाई एकदम हार्म गर्ने रिस्क एकदम धेरै हुन्छ त्यो पोस्टपार्टम डिप्रेसनले गर्दाखेरि सो यसमा चाहिँ फर एक्जाम्पल कसैको दिदीले कसैको आन्टीले कसैले घरमा बच्चा पायो यताउति रिसेन्टली पाएको छ भने पनि घर फ्यामिलीमा चाहिँ त्यो मुड चेन्ज हुन्छ नि इरिटेसन भइराको हुन्छ उनीहरुलाई चाहिँ त्यो यो पोस्टपार्टम डिप्रेसन पनि एक्जिस्ट हुन्छ है भनेर चाहिँ म हुन्छ नि एउटा इन्फर्मेसन दिन चाहन्छु
धन्यवाद शारदा पनि हो बच्चा पाउनु बित्तिकै हार्मोनल चेन्जले गर्दा कतिपय आमाहरुमा डिप्रेसन हुने हुन्छ हामीले यस्तो कुराहरु बुझिदिनु पर्यो हैन परिवारले पनि सहयोग गर्नु पर्यो अथवा आवश्यक पर्यो भने क्लिनिकली पनि हेल्प सिक गर्नु पर्यो धन्यवाद अनि finally I have listed a few helplines available in Nepal because all said and done, if there is a case is serious, or even if it is in the beginning, definitely we'll need some kind of professional help at some point. And as we already talked about the stigmas, there is no harm in seeking out help, as we do in any other field, right? So I have listed a couple of numbers here. Main is the partner hospital, which is the central hospital in Kathmandu. And apart from that, there's Tooth Suicide Hotline also. If anybody is feeling they can call, it's 24-hour available. So we should definitely seek help for these kind of things. So I think that kind of helpline is available here, even more than Nepal, I guess, Dr. Phil.
Probably.
Yes.
So yeah, again, having as many resources available as possible, having people know about them, making them as easy to contact as possible is very, very important. And actually for providers, they've found that's most helpful in preventing suicide is when the person is depressed, having someone follow up as often as possible and over a longer period of time. So it's not just, you come in and if it's a mild situation, you can come in and things get back right on track. But for people who have real chronic serious depression, having someone follow up and contact them regularly is very useful.
Thanks, Dr. Phil. अर्को कुरा हामीले पनि यदि हाम्रो आत्महत्याको विचार आउँछ भने कुरा के याद राख्नु पर्यो भने आत्महत्या समस्याको समाधान होइन, यो त पलायन हो, हैन? मरेर जाने भन्दा पनि उसको बाँकी रहेको परिवारलाई अझै ठुलो चाहिँ आघात पर्ने हुन्छ। यसमा शारदा बहिनीको के भन्नु छ नेपालमा अब?
यसमा चाहिँ एउटा डिप्रेसन, यदि सिभियर डिप्रेसन छ भने चाहिँ अब उनीहरुको सुसाइड गर्ने प्लान हुन्छ नि, एकदम रेट हाई नै हुन्छ है। र त्यो केसमा चाहिँ फ्यामिलीले चाहिँ एउटा त्यो हेर्नुपर्ने कुराहरू चाहिँ सुसाइडल क्यू भन्छ हैन। अब त्यो भनेको अब यहाँ चाहिँ गन हुन्छ हैन, वी आस्क देम इफ यु क्यारी गन भनेर हैन। अब नेपालको कन्डिसनमा चाहिँ फर एक्जाम्पल त्यो मान्छेहरूले नेपालमा कसैले चाहिँ विष हुन्छ नि, विष खाएर मरिरहेको हुन्छ, त्यस्तो केही सस्पिसियस बिहेभियर हेर्न एकदम जरुरत छ हैन। कसैले चाहिँ अब ह्याङ गर्नको लागि डोरी किनेर लिएर आएको हुन्छ, अब डोरी लुकाइरहेको हुन्छ हैन। सो त्यो चाहिँ त्यस्तो बिहेभियर हेर्न चाहिँ एकदम जरुरत छ हैन। अनि अर्को चाहिँ इट्स जस्ट लाइक कोही चाहिँ एक्लै बसेको छ भने दे माइट ह्याभ हलुसिनेसन हैन। सम पिपल कुड ह्याभ auditory hallucination, some people could have visual hallucination हैन। अब कोही एक्लै कोठामा बसेर नभएको मान्छेसँग चाहिँ कुरा गरिरहेको जस्तो छ भने त्यो कन्डिसनमा चाहिँ उनीहरुलाई चाहिँ अडिटरी हलुसिनेसन भइरहेको हुन सक्छ अथवा भिजुअल। सो उनीहरुलाई त्यो कन्डिसनमा चाहिँ दे माइट हियर अ साउन्ड जसले चाहिँ उनीहरुलाई चाहिँ कमान्ड हलुसिनेसन भन्छ के। त्यो चाहिँ यु आर वर्थलेस हैन, यु शुड किल योरसेल्फ भनेर त्यस्तो इन्स्ट्रक्सन दिएको हुन्छ के त्यो कन्डिसनमा। सो त्यस्तो कन्डिसनमा चाहिँ त्यस्तो बोलेको छ, केही छ, कुरा गरिरहेको छ भने चाहिँ उनीहरुलाई चाहिँ हेल्थ केयर प्रोवाइडरसँग चाहिँ कन्ट्याक्ट गर्न एकदम जरुरत छ। द्याट्स द मेन सुसाइडल क्यूज।
धन्यवाद बहिनी। त्यही त कसैले त्यस्तो चाहिँ अनौठो व्यवहार गरेमा, एक्लै बोलिरहेमा अथवा केही डोरी सोरी खोजेमा हैन अथवा मुसा मार्ने औषधि खोजेमा हामीले एकदम विचार पुर्याउनु पर्यो र यी रिसोर्सहरुमा रिच आउट गर्नु पर्यो। Okay, thanks a lot, Dr. Phil, for being with us today out of your busy schedule. And if need arises, I may trouble you again, but this is good enough for now, I guess. धन्यवाद शारदा बहिनी पनि एकदम आफ्नो व्यस्तताको बावजुद आइदिनु भयो।
Thanks for having us.